Hello, everyone, and welcome to part two of our lecture on CMS 1500 and UB04 claims in our healthcare settings and claim cycle and claims processing class. I am Ms. Blair, and I'm going to take us through our lecture. So what are we going to do? We're going to wrap up talking about the CMS 1500 claim. Then we're going to explain the UB04. We're going to talk about data specifications, and then we're going to talk about the claim submission of our UB04. Now, the UB04 is not as, I don't want to say difficult, but it's not something that we're going to see a lot unless we're going to be in an inpatient setting. So here we go. So what's some common errors when we talk about the CMS 1500 when we are processing them? So remember, we are now in the electronic age, okay? And in our textbook, some information still deals with paper claims. So that's okay because there are very few instances when we still have to use a paper claim. So it's okay to know a little bit about it. So one of the biggest common errors is keyboarding errors, when we incorrectly enter data or we have a misspelling. We also omit data where we do not put data in the blocks where they are needed. I don't know if you can remember, but if you have your book out and look at what the CMS 1500 looked like, there were numbered blocks where specific data was required. Sometimes, if there's a specific or special service or a claim was denied because the third party payer said, I need additional documentation in order to decide whether I'm going to pay for this service, they would have rejected it or denied it and sent it back to the provider. And then at that particular time, then you have to make uh, attachments for that claim from the provider's documentation. And if you don't put the patient ID number on the documentation, the third party payer doesn't know whose data it is so that they can review it. Here we go with things for paper claims. If you don't align the printer properly and then the data doesn't go in the blocks like it should, that would have been an error. Handwriting used to be horrible when we had to fill out claims by hand. It was just something you don't want to do anymore. And here we go. Failure to link a procedure with the correct diagnosis. That has to do with medical necessity. And on the claim, we did look at the diagnosis area, which is block 21, and the procedure area, which is block 24. And if the procedure is not matched with the correct diagnosis, you will not get medical necessity, which is the rule for every procedure. It has to be medically necessary. And if it's not shown like that on the claim, it won't be paid. And then we'll have a problem. So just think about some of these things when you are entering data, if you are a biller or become a biller, or if you become an auditor, if you become an accountant, there are many career paths that you can take when you learn how to bill and once you learn how to code. You don't have to just be a coder or a biller. If I am an auditor, then I'm going to wonder why these procedures and diagnoses don't match. Is it a one-time thing, or is this a pattern? If it's a pattern, then I think we may have a problem. Now, is it abuse? or is it fraud? I have to think about that. Okay. If I am the health information manager and I'm tasked with making sure that the data is correct that is in our system, and I noticed that there's a lot of errors in data entry, then I'm going to go see the claims manager and say, what's going on with your coders? Why are there so many errors? And then they can look it up and say, is it just across the entire coding team, or is it just coder A? Now, is coder A, do they need training, or is coder A, do they need some other special type of attention? So there's lots of things that we can do once we learn how to code, or once we learn about coding. Um, Even people, you all from HCA, you're not going to code, but you're going to learn what it's about. And just like the omission of data can cause your claims to be denied. And then guess what happens when your claims are denied? Your money isn't coming in. You're the accountant, and then your cash flow becomes low. And now you want to know, why isn't the money coming in? So it's a whole multitude of career paths that you can take. Think about a career, not a job. Okay, no more jobs. There's careers that you can go up the ladder once you learn what we have to do here at UMA. So, the final steps in processing our CMS 1500. There's about 5 steps. Doesn't mean that for your particular facility where you will work that they may have additional steps that they want to put in. So of course you want to double check claims for errors or omissions. Now there's always, you double check. You should double check your assignments. You should double check your assessments before you hit submit. Take a minute, review it, see if there's anything you want to change. Did you miss a question? Always, always double check and review any work you do. Okay? Step 2, do you need to add any necessary attachments? You need to know guidelines. You need to know what that particular third-party payer wants. Okay? You need to post the submission of the claim in the system. Save the claim, okay? And then it's going to be submitted to the payer or to the clearinghouse. And then the clearinghouse will take care of the submission. It all depends on the provider or the facility, whether they do it directly to the payer or they send it to a clearinghouse. So that would be the end of the CMS 1500, which, remember, it is for outpatient services such as office visit to a physician or to a clinic, like that. Okay, so that means the next thing, or the next topic we're going to talk about, would be what? The UB04 inpatient claim. And it's very, very different from our outpatient claim. There are a lot of people who would prefer to do inpatient. There are some people who don't want to see an inpatient claim. It all depends. Now, let me say this. Everyone who works or does coding or billing in a hospital doesn't mean they're going to do inpatient claims. Physician groups are associated with the hospital, and their billing and coding is done in the hospital, and it's outpatient, and the billers and coders take care of it. They have particular provider groups that they are responsible for, and they do all the billing or the coding for that particular physician group. So, just because you work in a hospital does not mean that you're only going to do inpatient claims. In addition, when you work as a biller or a coder in the hospital, you are an administrative employee. You do not work third or second shift. You will work first shift, 8 to 5, 9 to 6, whatever it is. You could work overtime, but you do not work the same type of hours that as a clinician, like a nurse or a physician or a lab tech. Okay, so you have to understand that a lot of things happen in the hospital, but they happen differently depending upon the position and the department of what's happening. Okay, so let's get back to the claim, but I thought it was important to let you understand what happens at the hospital. So we know that they're used for institutional services. Now, the thing about the UB04 is there's data entry blocks, and we call them locators. There's like 81 of these locators on a UB04. Now, not every single one of the 84 locators are filled in for every claim. Okay. And what happens is, remember we talked about the charge master, uh, maybe 3 or 4 or 5 um, lectures ago. The charge master is where the encounter information is put once the patient sees the provider. And so that information from the charge master would automatically be put into the electronic UB04. Okay. And then, of course, as the biller or the coder, they would go in and they would look at this information, make sure it's appropriate and correct. So, what else do we do with a UB04? What else is it for? So, with HIPAA, which we talked about not long ago, um, the administrative simplification area, which is Title II, that's where the guidelines were developed about the data elements. What should go on this UB04? Okay, and there are guidelines about how to contain, or the guidelines contain instructions to complete the UB04. Um, Actually, it's on the website CMS.gov. You can find the Medicare manual, and it will contain the guidelines for all 81 of the fields. And providers that submit this 80 UB04, you get ambulance companies, home health care companies, quite a few will submit this UB04. Now, this is the form locator up close. You have the top of a UB04. So if you look at the arrows, you can see the numbers for the blocks. And then, for example, in block 1 on your right, where you see a arrow, in there you will put the provider's name, address, and telephone number. It's required. Now, the only way that you know that, because it doesn't tell you put the provider's name in there, it's just a blank. You have to go and you have to get that instructional document from CMS.gov. And then in number 2, you will put the provider's pay to address. Now, the pay to address is not always the provider's physical address. Okay, and then the patient control number. Well, at this point, we don't really need to know what that is. That's something special for inpatient. But as you can see, there are a lot of form locator numbers on this UB04. Now, how do we complete this UB04? Um, Third-party payers also have guidelines, and they tell you what particular locator boxes they want to have completed. Not all 81 are always filled in. Aetna may want certain forms of certain locator boxes completed versus United Healthcare may want another set of locator boxes completed. So you must know your third-party payers regulations. You have to keep up with that. And when I say you, it means the facility, and it should be programmed into the system. However, if you are working on that UB04, you will get to know the providers and the third-party payers and what they want. Now, remember with CMS 1500s, we can correct them and we can send them back in. And you could do the same thing with a UB04. And there's two particular processes. You can have an adjustment. And what an adjustment is within 1 year of the date of service, you can resubmit basically. Now, what is timely filing? Timely filing says within a certain amount of time from the date of service, you must file this claim. And every third-party payer has their own timely filing requirements. Okay. And for example, Medicaid, their timely filing is 365 days from the date of service. You submit that claim on the 366th day after the date of service, it's going to be denied and sent back. Okay. That's the worst denial that you could get is timely filing. Because if I am the head of the accounting department and I see that quite a few or a lot of my denials are coming back because of timely filing, then I'm going to go to the coding manager and I'm going to want to know why they can't get claims out on time. Okay, so then there's also something called a reopen claim. That's after the claims, after the time limit. That's really different. But for UB04, you could have a claim for, $60,000, $70,000 because it's an inpatient. This person had hospital bed. They had medication. They could have had surgery. They could have had anesthesia. So it could be quite a lot of money on a UB04 claim. So with that, it was just a quick overview of the UB04. And because we are at the end, you know what we do. We wrap it up. Information is also in Chapter 11. You know what we do. We are Team ME2550. We make sure we read our textbooks. We make sure that we do all of our assessments. We turn in our assignments on time. We make sure we do our discussion posts. We get help when we need it. We call tech support. And for our discussion posts, for our replies, we do not just say great job. We put down our own thoughts. We make sure we put down our opinions, and we have great discussions. And so with that, Team ME2550, I will see you or talk to you at our next lecture. With that, I'm going to bid you bye-bye.